Yeah. Hello, everyone. I welcome you today to the session of importance of influenza vaccine in a child by Apollo Cradle. To speak on this topic today, I would like to welcome Dr. Tahir Sheikh. He is a senior consultant with Apollo Cradle Hospital. He is a pediatrician and a neonatologist with 15 years of experience in this field. We welcome you, doctor, on this session, and
Yeah,
we look forward to hear from you and know more about the topic. Thank you, sir, and
yeah,
it's all
good
yours.
evening. Good evening, yeah, good evening, everybody. And I'm working here in pediatrics department from 4 years. I'm experienced in 15 years in pediatrics and neonatologist. So today's topic is influenza vaccination in kids. What is the importance of the influenza vaccine and what is the influenza virus infections? So we are talking about this briefly. We'll let you know what is influenza infection in children. So influenza means we are all know about this influenza vaccine long ago. The highest epidemic across the globe. Every time so actually global attack rate is 5 to 10% every year. Contamination rate is 5 to 10% for in adults and 20 to 30% in children. So influenza virus is three type of viruses are there, and type 1A, type A and B and C. So type A and type B is a human uh, this one outbreak. So type C is basically in animals. Uh, it's less often associated with a severe illness in the human beings. So what is the animal influenza? So influenza virus that are routinely circulating the animals. So what is the animal influenza means? We know about bird flu or swine flu. These are the animal influenza types. So it's also called as H5N1 influenza virus. So, so it's not easily transmittable to humans. So animal influenza does not transmit to directly. It's very rare in the this one transmitting to human. So long ago, in China, the outbreak was there. So a lot of people, some 500 people are infected in this animal influenza virus, but it's very uncommon in human. How to recognize the influenza? The mode of what is the presentation? Mode of the presentation. So it's influenza is the seasonal infection. It's a viral seasonal infection. They have two type of surface antigens. One is hemagglutinin H, we call as H, and N, neuraminidase. So it's every year they are changing their mutation in the this one spike proteins. That's why we are calling as a seasonal viral infection. Uh, all I mean every year they are getting viral infections. So what is the when is the season? Uh, so in northern hemispheres, like hemisphere, getting October to naturally May to May. In southern hemisphere, we are getting April to September. This is a seasonal infection going on all over the world. And India, like tropical countries, getting all over the whole year we are getting this infections sometimes. So it's continuing in tropical countries. So how to what is the pandemic? Pandemic. We are all every time is worry is the pandemic. What is the pandemic? So it's completely. whenever completely new strain will come, so nobody will have any like immunity, this new strain. So they will start pandemic. So actually, those times like this time, effective number of people with this short time span. So this is known as antigenic shift. So it looks at pandemic. If you look at pandemic, how many times this pandemic happened in the this one, like 4 times we saw pandemic in the last 100 years. The most effective pandemic year is 1918. So this was called as a Spanish pandemic also. So this is the worst affected pandemic infection in the 1918. It's called as Spanish flu also. And that time, 50 to 100 million people are got affected. I mean, died in 1918. It was a serious pandemic in the history. So, what is the H1? What is the H1 and N1 called swine flu? What is the swine flu? This is started in April in 2009 in Mexico. So it's called as swine flu H1N1. So by the time May 2009, the viral was isolated in India also. So by the time June 2009, the large confirm had been reported in 74 countries. So this is spread by 8 now November 2009. Worldwide, we have got lot of reported cases all over the 2000. I mean 206 countries. So in 2009, that is also uh, affected. So H1N1 called as novel H1N1 pandemic virus. That was happened 2009. So what is how it spread, like how it's contagious and how it spreads to kids and children and all adults. So it's mostly droplet infection. Whenever droplet transmission, this is a transmission count like sometime I mean if infected people coughing or sneezing, so it is transmission can occur. So it's sometimes touching the surface contaminated with virus, respiratory secretions, or and putting in the fingers, in the mouth or nose, or near the eyes also. Viral can transmit it to another person. Flu virus can live on a hot surface for 24 hours, and for soft surface can live 20 to 30 minutes. So it's how influenza spread to each and everyone. How long is a person contagious? So how long? 5 to 7 days after symptom starts. So children with poor immunity and those are severely ill children, they can contagious up to 10 days also. So, so then what we have to do? 10 days, the 5 to 10 days, sometimes 5 to 7 days. We should not send the children to school and all, and so we can control the contamination. So how to protect the this disease? So only vaccination, and so vaccination is the first part of the this mean protection, and avoid to contact, stay home with sick babies or sick child, cover mouth and nose whenever we are coughing, sneezing. So and thoroughly wash the hands every time, like touching the baby, or cleaning the respiratory secretions the baby. So we can wash hands with soap water or not, alcohol based hand sanitizer we can use. So we can prevent like this. So treatment wise, we are a normal symptomatic treatment only we are giving for all kind of flu like symptoms, like whatever what symptoms we have: fever, mild fever we have, sometimes high grade fever. Some children's getting nausea, vomitings, diarrhea. So we are so some of the other influenza virus also getting same symptoms, like sometimes, I mean, high grade fever, muscle ache, headache, cold, running nose, sneezing, sore throat, vomitings, and sometimes diarrhea also. So influenza illness typically resolves within few days, or we can say to 1 week. Sometimes cough will be persisting some like 10 to 2 weeks, maybe it's persisting sometimes, some sick babies or something. So uh, who is prone to get this illness? Who is more prone to severe illness due to influenza? So normally we can tell as 65, more than 65 years old adults, and children less than 2 years. So people of any age with underlying medical conditions, chronic I mean conditions like heart disease, liver disease, or any respiratory conditions, and kidney disease, diabetes, and immunocompromised children are prone to get this influenza virus. So, and below 2 years babies also, I mean, below 6 months babies also, they can, they are all having very less this one reaction. Immunity is very less, so they are also uh, can get infection and severe illness also. For that, we have how do we prevent this uh, below 6 months babies? So we are not giving vaccine up to 6 months for influenza, the influenza virus. So how to prevent? We have to take measures like whoever taking care of the baby. For them, we have to give vaccine for them, and mother, father, parents has to take vaccination to prevent the infection and spread to the newborn babies. So like that, we can prevent the norm. I mean, below 6 months babies also. So how to diagnose the infection, or how to diagnose the viral this influenza virus. So only we can have a viral culture, throat swab, and PCR test. We can do uh, normally available labs. So what about the vaccination? Which vaccine we have to give? What type of vaccines are there? So treatment we know, like only if it is severe illness, we can go for antiviral treatment for 5 to 7 days. Otherwise, symptomatic treatments, high grade fever, whatever fever medicines we have to use, and for cold medicines, and any vomitings, antiemetic medicines we are prescribing for babies. So if it is a immunocompromised child, any other uh, systemic disease, they are I mean babies. So we for them we are starting antiviral drugs also. If it is a very severe illness or respiratory distress syndrome, like after getting 2 to 3 days severe infections. Otherwise, we are how to prevent. Prevention is only vaccination. So, uh, vaccine. What type of vaccine we have? Uh, so, children's at least we have to give high risk babies, high risk group children's to vaccinate. Children younger than 6 months are high risk. So, severe flu complications. vaccination. So what type of the vaccines we have? So trivalent we have. One is trivalent, quadrivalent, and influenza A, influenza B are mixed virus also there. Mixed vaccines also there. So normally we are using for less than 2 years age of babies or children. We are using inactivated injections, and for nasal vaccine also there. It's a live vaccine. We should not use for more than 2 years. So that live vaccine can use health workers or normal healthy persons. We can use. So live vaccine, that is nasal spray, should not use below 2 years babies. So so what I so how to recognize the infection? What is the how to recognize it is a flu or influenza? So it's only can recognize like only high grade fever and running nose and normal throat, sore throat, and body aches, and sometimes vomiting, sometimes diarrhea also can occur. So we can recognize like according to symptomatically, and diagnostics tools also there, but it's resolving within 1 week, resolving infection. So no need to worry, and we can if it is any respiratory problems, any respiratory distress, we have to go to the doctor and take advice how to take medicines and all. So so we have inactivated vaccine, and in this whole cell vaccine we have, this is not using anymore, and that's subunit surface antigen vaccine and split variant vaccine we are using nowadays. So split variant vaccine means nowadays there is vaccigriv or flu quadri, like that. So how they decide how to give the vaccine, how many, I mean every year how to prepare the vaccine, and so what WHO, that's why they are preparing for northern hemisphere and southern hemisphere. So northern hemisphere they are whatever the season started from February, they are onwards they are starting to collect the whatever strains or new strains are coming. So in the southern hemisphere they are starting like on September they are before starting this winter seasons. So so that vaccination after 6 months uh, will ready to give. So before 2 weeks of peak of infection spreading, whatever before 2 weeks we have to give the vaccine. So what is our Indian IAP, Indian Association of Pediatrics recommendations? So 6 months onwards we can start the vaccine, whatever inactivated vaccine we are giving routinely in daily basis, daily practice. So 6 months to 5 years we can give this vaccine. So whatever more than 5 years, high risk babies we can uh, suggest for taking vaccine also, and healthcare workers also can take. So what is the normal schedule? 6 months, 6 months, and one dose onwards, and now after 4 weeks of the interval, one more dose. So that is the two vaccines in the first year of the life for all babies. That will protect you for 2 years. After 2 years, you can start yearly, again annually basis, and up to 9 years you can give the annual basis vaccine. So the dose is normally zero point 0.5 ml or 0.25 ml we are giving. So that is the vaccination. How much